Everyone see that okay? If I don't hear anything, I'll take that as a yes. Okay.
That's good.
Good. Okay, excellent. So, uh, we're going to be talking today about oral health and some of the oral health findings and dental implications of scleroderma. And like I said, I've really tried to narrow it down to three. I know that there are many more, but these are the three that when we see patients in clinic, we really spend the most time discussing, either because the patients have the most questions about it, or we feel that it's of high importance. And so we want to spend a lot of time educating them and answering questions and kind of coming up with ways to help. So again, we could have a list of 10. I have given presentations in the past with a list of 10 or 12. And I've really tried to pick the three with the help of some of our residents at work to try and narrow it down. So we kind of took an informal poll of some of the providers at work and just tried to really narrow it down for you so that A, I don't get too long-winded, and B, a lot of time for Q&A. Okay. So this is where I work. It is in Maywood. That's where the medical campus is for Loyola University Medical Center. And I'm in charge of the dental residency program there. So I've been really lucky to do that for just over 13 years now. And we see a really unique patient population. Some that come to Loyola because that's where their specialists are located, others because it's close to home, others because they have been referred there for various reasons. So that's where we work. We have a team of dentists that work within the hospital setting. And like I mentioned before, we have a team of dental residents. We have 6 residents every year that come to train with us for 12 months and really learn how to treat different patient populations, get to treat patients with special needs. That's a big part of our practice. Doing dentistry in the operating room setting where patients are asleep, and dealing with trauma and things like that that might come in from sports injuries, car accidents, bike accidents, um, any type of facial trauma that we might see. So I don't know exactly who is in the crowd, and I'm not going to click on the chat, but this is our current group. So some of you may recognize some of these faces if you come to Loyola for your dental care. Okay. So the objectives here of the talk, like I said, is to just discuss, some of the most common oral findings associated with scleroderma. The three that we've narrowed it down to is xerostomia, limited opening, and then widening of the periodontal ligament. So we'll dive into those a little bit more in detail. We will discuss some ways that we can help patients manage these conditions, and then we'll do a Q&A at the end. Okay, so please, like Stephanie said, either throw your questions into the chat or write them down or keep them in some format, and then I promise we'll get through all of them within the time constraints this evening, and afterwards I'll provide my email and happy to do any that we don't get to tonight. Okay. So xerostomia is the first one that we mentioned. Again, going back to the xerostomia, limited opening and widening of the PDL. So xerostomia just means dry mouth. So a lot of patients with scleroderma and with a lot of different conditions do experience dry mouth. And related specifically to scleroderma, and again, this talk is more focused on the oral health implications. So I didn't get into the systemic disease of scleroderma, some of the different organ systems that it can affect, just again because of time constraints. So again, happy to discuss that. And I know a lot of the people on the presentation today, if either you or a loved one or someone in your life is diagnosed with scleroderma, you have a lot of background information. But again, happy to chat about that afterwards as well. So, xerostomia secondary to scleroderma sometimes is caused by the destruction of the salivary glands, and it causes a lot of issues. So we use saliva. Saliva for human beings is really, really important. It does a lot of things, helps us, eat, chew, speak, helps us, kind of buffer the pH in our mouths to keep us within a range. So all of that is secondary to saliva. If you drink something really acidic, your saliva kind of washes off the teeth and the tissues in your mouth to bring it back down to that kind of neutral pH that our mouth an oral cavity tends to live at. And same thing if you eat or drink something that's really basic, it buffers that up to kind of keep it in that range. So your saliva does a lot of great things. And sometimes some of the medications that patients are taking due to their scleroderma or due to how the scleroderma affects other organs in their body, cardiac, for example, kidney, lung. I know a lot of those organs are affected by scleroderma. And so sometimes patients are taking medications, a heart medication because of a cardiac condition secondary to their scleroderma. And a lot of these medications cause issues in the oral health cavity or the oral cavity. Okay, so for an example of that would be patients who are taking a calcium channel blocker, which is for heart issues. And we see sometimes some inflammation and overgrowth of the gingival tissue, the gum tissue in the mouth. So again, sometimes we see things in the mouth that give us a little bit of a gateway into what's going on systemically and the rest of the body. Okay. Um, Having a dry mouth or having a decreased production of saliva does put patients at an increased risk of a lot of different things, periodontal disease, increased risk of cavities, fungal infections, denture retention if patients are wearing a complete denture, um, and they rely on the suction and the moisture in the mouth. If you don't have those things, it can really make life miserable, unfortunately. Okay. So a few products. And again, I don't have any disclosures. I don't work for any companies other than Loyola University Medical Center. So any of these things that I show you, A, are taken on my iPhone. B, are taken in the past 3 weeks, probably a month. Some of them were taken over the weekend because I just always, when I'm in the Walgreens or CVS or the grocery store, I always take my final lap in the oral health aisle just to see what's out there because we need to know as providers what we can offer up to our patients over the counter. And I also like to kind of know like the price range just so I can kind of give people a ballpark idea of if we're going to prescribe you a mouth rinse, a heavy fluoride mouth rinse, that's a prescription and it might cost you X, you can get something over the counter that is 1/3 the price and just as effective or pretty close to as effective. Okay, so I do that more just because I'm a dental nerd and I like to see what's out there, but also just so that we have an idea of what we can talk to patients about. Again, not having a preference, to be honest with you, as to which one, you should use or you could use. I don't have any financial interest in any of these companies. So one of the big ones that you hear, and this is from the weekend, so this is very updated as far as prices and what's available, is Act. Okay, so that's the name of one of the brands, and Act has some incredible mouth rinses that are really high in fluoride, and that's what patients who have xerostomia, dry mouth, really need. Okay, because if you have an increased risk of cavities then you really need to be trying to do things to counteract that. And using a toothpaste and using a mouthwash that are really high in fluoride, do that. Okay, so dry mouth equals mouthwash and toothpaste with fluoride. Okay, ACT equals the highest concentration of fluoride that you can get over the counter in a mouth rinse. Okay. So another great thing about ACT is that they incorporate, excuse me, zero alcohol in a lot of their mouth rinses. Okay. And how that ties in is if your tissue is already dry, alcohol dries it out even more. Okay, so if you have a mouth rinse that contains alcohol, which a lot of them do, and alcohol does have some good things associated with it as far as cleaning properties. If you already have dry mouth and you use a mouthwash that contains alcohol, it will dry out your tissue even more. Okay, so at the time of swishing and rinsing your mouth, it might feel really good and it gives you that feeling that it's working. However, afterwards, once you spit out the mouthwash and things kind of calm back down to normal, your tissue will be even drier and your mouth will be even drier than it was before. Okay, so two things to remember here for mouth rinses: no alcohol, okay, which is again listed and advertised on the bottles everywhere. So no alcohol and high fluoride. Okay, so the Act mouth rinses, and as you can see here, $6, for a little bit of a bigger bottle, 6.49. This is at Walgreens, so they have a lot of great options. Okay, so just things to remember there as far as the fluoride mouth rinse. Other great things for dry mouth, there's lozenges. That again, these are a little bit pricier, but anything that you can use to try and stimulate salivary flow, and lozenges and gum are really good things to do that. One thing as a little side note, similar to the mouthwash, with the lozenges and gum, is anything that you use, you want it to be sugar free. Okay, so a lot of gums that you can buy, check out at the grocery store or in the aisle of Walgreens or wherever. Just have a quick look at it, make sure that it's sugar free. And another added bonus is if it contains xylitol. Okay, so xylitol is something that helps with the fight of cavities. All right. Act in addition to the mouth rinses, they also have gum. Okay. So again, similar to lozenges, uh, just a gum to stimulate salivary flow. And again, Act and Biotin are two of the products that have really kind of taken on a lot of the market in the dry mouth area, and are really good products. So again, just mentioning the different things that they have, the gum, the mouth rinse that we talked about, and most of the products that these two companies have are sugar free, are alcohol free, and have a lot of fluoride or xylitol in them. Okay. Like I said, biotin is maybe one that's a little bit more well known. And again, they have the rinse, they have a spray, they have a gel, they have a toothpaste. So all of these things, you can kind of see price point here as well. It's in the $8 to $9 range for all of these things. For a smaller bottle, $5.50, bigger bottle, just under $10, and the gum is $5. Okay. So anything that you can think of that will help with stimulating salivary flow, lubricating tissue, helping with the dry mouth. Biotin and Act really have a lot of good things. Like I said, biotin just on the slide on the left alone. We've got the mouth rinse. We have a spray, which is a spray bottle that you put in the tissue, a gel, which is really good for kind of lubricating the tissue and helps with comfort, and then toothpaste. So four things right there, reasonably priced, that you can just get over the counter at any of your stores that you purchase products at. Okay. Mouth rinses, every once in a while, we need to kind of up our game and provide something to patients that is not over the counter. And your dentist is able to do that for you. So some people have a little bit more experience doing that on a day-to-day, week-to-week basis than others, and that's okay. At the hospital, we do this all the time because of the patient population that we care for. A lot of patients that are undergoing head neck radiation experience issues with salivary flow, have really dry mouth, have mucositis, which are ulcers in the mouth, secondary to radiation, secondary to chemotherapy, really painful ulcers in the mouth that sometimes they're so painful they can't even take a sip of water to swallow their pills that they need to take. So again, mouth rinses we can mix up. Sometimes it's a little game of trial and error. The residents get really good experience doing this. We can add different things to a mouthwash in the hospital or at a compounding pharmacy. So sometimes pharmacies in your neck of the woods might not have a compounding pharmacy, meaning that they can mix up a mouth rinse, but they'll know where one is. Okay, so not every Walgreens has the ability for a dentist or a physician to call up and mix up a mouthwash containing different components. However, that pharmacy, if they don't have it, they'll know where the nearest one is. And a lot of times they can pass that on, have that pharmacy mix it up and ship it to them, within a day or two, to get it in your hands. Okay, so that's one thing to just kind of keep in mind. If patients have a fungal infection in their mouth, sometimes secondary to dry mouth, then we can mix up something in the mouthwash like a nystatin, which is an antifungal, that we can put in there. If they have a little bit of a herpetic outbreak, some type of viral outbreak, we can put in an antiviral. Again, if there's a bacterial component to that, we can put in some tetracycline, which is an antibiotic we can put in the mouthwash. If it's simply to give them some pain relief, and allow them to take some sips of water or smoothie, or even just sip water to swallow their pills, We can do it strictly for palliative reasons and, mix up some viscous lidocaine, which will kind of soothe and numb the area, allowing them to be comfortable and swallow their pills. So this is one of my favorite products here. You can get it on Amazon. I don't know exactly. Uh, I haven't found a grocery store or Walgreens or CVS where you can purchase this over the counter. I've looked at a whole bunch of different places, but you can get it on Amazon, and the Amazon drone will drop it off, uh, at your porch. And these bottles, usually, I think, don't quote me, and I think you get two bottles, and it's like $10 or $12. Okay, so it's kind of within that price range that we talked about. Very good for ulcerations, very good for lubricating the tissue in the mouth, and biggest thing here is alcohol free. Okay, so prevention is something that we recommend to patients every single week at the hospital. Has a lot of great things about it, and this was uh, passed along to me by a pediatric dentist who swore by it, and now we've kind of adopted that as well. So, second kind of big category outside the dry mouth is the limited mouth opening. And so sometimes this can be caused by collagen deposition in the connective tissue that leads to fibrosis and then more of a progressive limitation of the mouth opening. And other times it's due to microstomia, so a physically smaller mouth. Okay, so it can be sometimes a combination of those two. Sometimes it can be, you know, simply you have a limited opening or a smaller opening because you have a smaller mouth, or it can be because sometimes the tissue that surrounds the mouth, the lips, the oral cavity, the tissue around the cheeks, instead of being nice and elastic and stretchy, allowing you to open your mouth real big and move side to side and things like that. Similar to how the scleroderma affects your elastic muscle fibers and tissues in other areas of your body and other organs, same thing in the skin. And so that sometimes limits the opening just because the mouth and the skin around it cannot stretch, uh, the way that it normally would. Okay, so those are things that are a challenge for patients when they are trying to care for their teeth and really get to different areas of their mouth and get back there to floss or to brush their teeth. Really challenging for patients to do home care. On the flip side of that, it can be very challenging for your dental team to try and get in there and do the same thing. So, if you see your dental team for cleanings, sometimes it's very challenging for the hygienist to get instruments and hands back there to certain areas to clean those areas, similar to how it is for you at home. So, those are things that we really take note of. We measure the first time we meet you, we'll measure your maximum opening, have you stretch as big as you can, and take a measurement, and then we follow up with that every time we see you. So that's just to make sure that your maximum opening or how big you can open is not getting smaller at a really quick rate. Okay. Because sometimes if that's the case, if we see you every 3 months for cleanings and every time we see you, if your maximum opening, normal people, on the street walking around, average maximum opening is 30 to 40 millimeters, 35-ish, which is about 3 fingers for most adults. 3 finger width is about 35 to 40 millimeters. And so that's kind of a quick rule of thumb if you try that. We also measure that. So if we see you at your initial appointment and your maximum opening is 35 millimeters, we would consider that to be within normal limits. If we see you in 3 months and we measure it's 32, we see you in another 3 months, it's 29. We see you in another 3 months, it's 26. You're trending in the wrong direction, and that's not your fault, but sometimes that will change how we come up with a plan for you. We might be a little bit more aggressive in treating areas that are hard to get to, knowing that your maximum opening is decreasing. Okay. There's all these fancy gadgets that you can use to measure. We use just an old fashioned disposable ruler. It's just a paper, kind of hard paper plastic ruler, gives us a good accurate reading, and it's simple to use. So again, you can use these gauges, different, electronic ones that'll give you the reading, or you can use just a simple ruler that, we grew up with in school. So widening of the periodontal ligament is kind of the last thing, and then we'll talk about a few little ways that you can help yourself and your dentist might be able to help you. But one thing that a lot of patients do note, and a lot of dental providers will note, and sometimes reach out to us and say, "Hey, can you look at this X-ray? I have this patient, and I've never really seen this. This is kind of strange, or this is unique." And so we always bring it to patients' attention so that if you are a patient of our practice and then you move or you go to a different provider, and they mention it to you, you've at least heard it before. And that's what we want. We just, nobody wants any surprises with anything. And so we just want to mention it to you. So this is classic, textbook, literally textbook on the dental board exams that we take and tests that we take. The differential diagnosis, if we look at an X-ray that has a widening PDL, the answer is scleroderma. Okay, so we don't exactly know what causes it. We know that it's related to scleroderma. It's discovered when we look at X-rays. Okay, so your dentist might point it out to you. It's not something that we can look in someone's mouth with our eyes and say, you have a widened periodontal ligament. Okay, it's not something our eyes can see. It's something we can only see on X-ray, panoramic X-ray, periapical X-ray, things like that, where we can really see details. We can't see it with the naked eye. And what the periodontal ligament is, or what it does, it's a shock absorber. Okay, so if you picture, uh, a sleeve that would go around the root of a tooth, almost like a sock. So if you pull a sock up over your foot and up, up to your knee, it's a really thin, kind of cushiony material, and it acts as a shock absorber to the tooth that's within the bone. And it also provides stability, okay, for the tooth within the bone. And so periodontal ligaments, when they become widened, sometimes lead to mobility of the teeth. And also, if it becomes widened, there's the ability for bacteria and things like that to get down into kind of the base of the root or the periapical region of the tooth, which can lead to issues, periodontal disease, infection, things like that. Okay, so the periodontal ligament surrounds the root of a tooth, which is in the bone, and acts as a shock absorber, and also to kind of hold the tooth in place. If the PDL widens, then it just creates a little gap, and I'll show you on some x-rays here. So this is kind of, if you can see my arrow, I hope, what a normal PDL would look like. So this black line that is around the root of a tooth, and this is all bone. So this is within the bone. Kind of see that kind of hairline black line. So when it's wide, you can see on this tooth a little bit wider, right? Similar on this tooth. There's a wider gap, a bigger gap here and here than there is on this tooth. Similarly here, big gap around here, big gap around here. Okay. And same with this one. Okay. So this is a back molar. This white part here is a crown that you would see in the mouth. And then the roots are within the bone. And you can see here, if you compare these two teeth, this one here has a very faint, thin black line around it, which is the periodontal ligament. This was what we would consider normal. And then on this tooth here, you can clearly see, even with an untrained eye, you don't have to be a dentist to see how much wider this space is, between there. Okay. So just something that we make patients aware of. If it leads to mobility, then that is often the conversation that we have when we talk about, a plan for that. So something to make you aware of. Okay, this is just a bigger panoramic X-ray, and again, you can see widening of the PDL on kind of a bigger scale than just those smaller individual films. Okay, and this is a film of a patient with scleroderma. So some things that can help, and then we'll finish up and open up for Q&A here. So electric toothbrushes. Sometimes patients have manual dexterity challenges. Sometimes that's secondary to scleroderma. We also know that a lot of the autoimmune conditions sometimes come in pairs. And so a patient might have scleroderma and rheumatoid arthritis, might have lupus and rheumatoid arthritis. So we know that our patients with RA sometimes have challenges with manual dexterity, fine motor skills, and things like that because of very painful rheumatoid arthritis. Okay, so electric toothbrushes are great. These are updated photos here that list some different options of things that you can use. Some of them more expensive than others. That can really assist you if you have trouble, working the toothbrush with kind of the old-fashioned toothbrush that you'd go up and down in small circles with. These are ones that we have in the office that we uh, can provide to patients. So again, just different models and different brands, and they all kind of do the same thing. Other patients, if they have issues with manual dexterity and can't, grasp tightly a very small toothbrush, we make a bigger handle. Okay, so one of our hygienists in the past used to poke a little hole in a tennis ball and then slide the toothbrush, um, bottom of the toothbrush into the little hole, and then they hold on to the tennis ball. Okay, so that's a creative way to do it. This is just foam. These are rubber bands. This is a little thing that students sometimes put on a pen or a pencil that you can put on the end of a toothbrush. This is just a floss pick, but you can put on the bottom of the toothbrush just to make it thicker and a little bit easier to hold and manipulate. Ways to improve your maximum opening or maybe slow down the rate at which it's decreasing. We can use tongue depressors. So those are just a fancy term for popsicle sticks. You stack them, they're easy to use and they're cheap. So we have, boxes of 500 at the hospital. And we just give them to patients if they need them. So you just stack them up. And the goal is to just increase the number of popsicle sticks, by a couple or a few every day until you get to a comfortable, uh, you know, uh, distance to just keep your mouth stretched open. We tell patients to do that. If you're watching your favorite show on TV at night, do it during commercials. Okay, so most shows have commercials 2 or 3 times. If it's a half an hour show, 2 or 3 commercials. Commercials are usually 2 to 3 minutes. So every commercial, take out your popsicle sticks, pop them in your mouth. It'll give you a good stretch. When the show comes back on, take them out, give your jaw a little bit of a break. So do that while you're watching TV. You don't have to do it while you're watching TV, but that's a kind of a quick, easy reminder of when to do it. And we do see good results with that. Okay. This is one of our former residents demonstrating how to do this. So again, it's just a stack of popsicle sticks, put them together, pop them in your mouth. Okay. Other ways to improve the max opening that are a little more advanced than putting popsicle sticks in. There's a couple devices that we have, the Therabite and the OraStretch. One thing is that both of these devices do require a prescription and parts, and sometimes a letter to your insurance company, but that's okay. We have letters that we write for patients often with pretty good success. And it helps increase your maximum opening, easy to use, and we get good success. Okay, so that's what these look like. This is the Therabite. This is the OraStretch. And they come with a little, kit that you can put the stuff in. That is all I have. How am I on time? So we can open it to questions.